I'm Gloria Strode and welcome to Straightforward. Today we have one of our awesome kidney doctors from that wonderful Renal Associates team. Dr. Ramanath, welcome.
Thank you, Gloria. It's always a pleasure. So nice to see you.
Yes, it's been a while since you were here, and since you were here last, you've had an addition to your family.
I do. I have a beautiful baby daughter who's now 1 year old.
Really? Wow. So it's been more than a year since you were here. So that's keeping you busy. Now she's ready to move around and start touching things pretty soon.
Oh yeah, she's putting everything in her mouth. That's the problem.
Oh, really? So we have done so much with educating the community on kidney care. Today I just want you to explain to our viewers the different stages of kidney disease. It's not the end of the world if you have a kidney problem.
Absolutely.
Some things you all can fix, and some things you all just help the patient with maintaining. Okay, so share with us the different stages of kidney disease.
Okay, so and that's a great topic, you know, because a lot of the times when we see the patients and when they hear we are kidney doctors, sometimes it's like, wow, you know, it's
They're
almost like afraid and frightened, and the first thing we try and do is it's not always doom and gloom, you know, it's not the end of the world. A lot of it is very, very treatable and reversible. So the first thing which I wanted to talk about was then there are two types of kidney disease. Like one is acute kidney injury.
Okay, acute kidney injury. And so what is that?
So acute kidney injury is when something happens all of a sudden. It is like an abrupt onset, and a lot of the times it is reversible.
Okay.
Completely reversible. And then there's the other aspect, that's what we call as the chronic kidney disease. And that is more kind of chronic in nature and long-standing.
And long-standing. So what would be acute? Is it kidney stones or kidney infection, or would that be considered acute?
Correct, yes.
Okay.
So acute kidney injury can happen from a number of things.
Okay.
One of the most common things, like you said, one is kidney stone, you know. Small stones, a lot of the times we pass them without any problem.
Really?
Yeah, except that it pains.
Right.
Like
yeah, I've heard
bad.
people say passing the kidney stone is like having a baby.
Exactly.
So it can be painful for men or women.
Yes.
Okay.
Absolutely. So yeah, the kidney stones can be painful, but a lot of the time the smaller stones you are able to pass without any problem. Occasionally you will have kidney stones which cause blockage to the urine flow. And then the kidney gets under stress because of the urine not being able to flow freely, and you get kidney injury because of that.
Okay, so with the blockage, that's putting strain on the kidney, and that's also causing pain for the individual.
Yes.
So how do you treat that though?
So the way we treat that is that you give them lots of fluids. You can give them plenty to drink intravenously. A lot of the times making them very well hydrated just helps to move the kidney stones off.
So that is why we really need to have that water, all of that, on a daily basis.
Absolutely.
Because the kidney, I think it was Dr. Alapan once told me, it's like that filter, like the coffee filter. Right, okay. And so with the kidney stone, what causes that? Is it a calcium or what is it?
Yes, so a lot of the times the kidney stones are mainly, are calcium-based stones. And sometimes there are some people who tend to have more stones when compared to the others. Like occasionally it runs in the family.
Really?
Yes.
So it's kind of almost like a genetic thing. They're predisposed to having those.
Yes.
And that's important. That's why family medical history is important.
Absolutely.
And you all want us to fill out all those forms when we come in so you could know what plan of action to take for us.
So so then again, as I said, a lot of the times we hydrate them well, and that itself a lot of the times is enough. Occasionally, if the stone is not moving, or if it is causing like bleeding or anything, then we cause one of our surgery colleagues to come in, and they go in and take the stone out and do like a surgery to have it out.
Oh, okay, so they can actually go in and remove it without damaging the kidneys.
Correct.
And then the kidney goes back to
then,
being regular functioning.
Absolutely. So
okay.
So that's one of the causes of what we call as acute kidney injury. So a stone which can cause blockage, but once you relieve the blockage, then it kind of gets
right. So you go back to your normal.
Correct.
It's not because And you know, there is always the myths. You had a kidney stone, so you're going to be on dialysis.
No.
You don't go from 1 to 10.
Correct.
It doesn't work like that.
Yes. So.
Right. So is it diet with the kidney stones? Should we, if people if that runs in their family, should they avoid not having so much calcium?
Well, sometimes it's what we say is the most common thing is, you know, to make sure they are well hydrated.
Okay, the water.
Water is very, very important. So especially if you have a history, we say that you should drink more than normal, so almost like a gallon a day or something.
A gallon.
Almost.
And most of us cheat. We have that struggle with just getting that those 8-ounce glasses in. So instead of having soda or sweet tea, we're in the South, you know, we love that. Of course, you see that a lot in your office. We really need to replace that with water.
Yes.
Just plain H2O.
Yes.
And we don't have to buy designer water.
You just have to go.
We can
just
drink
regular.
tap water.
Yes.
Right. So it's no excuse for if people work. Well, I ran out of bottled water, so they can just drink it from the fountain at work.
And most of the times people, you know, have 1 or 2 stones, and that's all they need. They don't, you know, you just keep well hydrated, you know, and that's all. Most of the times is okay. Occasionally, as I said, you know, if it is big or if it is causing problems, we send them to the surgeon or a urologist, and they kind of either break the stone and take it off or take the stone off completely.
Oh, really?
Yeah.
So they have some technique where they can just go in and just break it up like a piece of ice.
Yes.
And then it's able to pass.
And then it's able to pass, yes, ma'am.
Oh my goodness.
So.
And so usually how long does it take one to pass? It's based on the individual,
Yeah,
it's no special.
Yeah, and then also based on the size and where exactly it is located, kind of those it's based on those things. So.
Okay. And so if someone is sick, then they can just, not just with the kidney stones, is it can they have pneumonia or something that triggers them into?
Yeah, that's a great question, you know, because that's one of the most common things that we see. You know, somebody comes in throwing up, having you know, bad nausea, vomiting, and then we find that they have either like a pneumonia or a kidney or in some cases pneumonia or a urine infection.
Really?
You know, and then the next thing we know is when we do their blood tests, we find, oh, their kidney numbers are a little abnormal and they got kidney, you know, a kidney injury.
Right.
So, and that usually happens because, you know, because of the infection. If it is really severe,
right,
you know, you can have
and
low, you know, your blood pressure can go down,
up and down. So it's affecting those numbers.
Yes.
Okay.
So what happens is that the blood flow to the kidney kind of gets a little low, and then you get the kidney injury.
Okay.
But the good thing is, you know, we can treat it.
We can.
Yes, ma'am.
And that's a good thing.
Yes.
Well, what we're going to do is go to our first break to our sponsors, and we'll be right back. We'll be right back after word from some of our sponsors. Straightforward is brought to you by Chalk by Quincy introduces Excellence Redefined, timepieces of the finest technology, luxury, and class with tons of style at chalklifestyle.com. Renal Associates, LLC, a team of physicians dedicated to excellent kidney care with 5 convenient locations to serve you. Stark Avenue, Columbus, Bradley Park, Columbus, Lafayette Parkway, LaGrange, East Burkhalter Avenue, Buena Vista, and Springs Street in Warm Springs. The Framing Factory and Art Gallery, specializing in quality art and framing for all your needs. Original etchings, limited editions, and prints. Call Carlton Dickey today at 706-324-3823 or visit the Art Gallery at 1325 17th Street in Columbus. Vanessa Jackson's District 3 Successful Scholars Program, supporting students in achieving academic excellence, outstanding citizenship, positive social and cultural growth, believing in success for kids.
Come meet your new best friend at Paws Humane.
Adopting from your shelter makes sense. You get a great friend checked by our vet. They're fixed, all shots, microchipped, all ready to make you and your family's life better. 4900 Milton Road, Columbus. Paws Humane.
Come meet your new best friend at Paws Humane.
welcome back to Straightforward. I'm continuing my conversation with the awesome team member of Renal Associates, Dr. Ramanath.
Thank you.
You all do excellent kidney care, and I say this every time the team visits. You all took excellent care of my father, who ended up being your patient at 90 years old. And you all said that, well, with this treatment, he can probably live 2 years or more, and that's exactly what he did. And you all were just excellent in terms of continuous care. The team, you cover a lot of territory, but you all talk to each other. There was never any guesswork in that. And that makes the patients and the family members feel very good. So whether it was you or Dr. Smith, Alcade, Shohan, or Alapan, whoever came in to visit him already knew what had happened the day before and was just, you know, it was continuous. And so there's already fear when we hear something's wrong with the kidneys. You have to go on dialysis. But you all always head and shoulders above the rest. You're making it better for the patients and families.
Yes.
Because those with chronic, they have the option of in-home.
Yes.
Okay,
Yes.
share that with us.
Yes, so in patients who end up having really severe chronic kidney disease, or what we call as end-stage kidney disease, and who end up requiring dialysis. Now, in the past, the only option was you go to the dialysis unit 3 times a week and do the dialysis there.
For several hours.
For several hours.
Which means you need transportation to and from if you're not driving yourself.
Absolutely. And then the dialysis is typically about 3 or 4 hours a session. So if you take into account the going, getting ready, going there, coming back, your half your day is gone just with dialysis. And if you are working, then it becomes a really difficult, you know, to try and, if you are working full time, to try and juggle everything.
Yeah, 3 times a week. That's a lot.
That's
and that's
a
a lot of missed time in your workplace.
Absolutely.
Okay.
So we got, nowadays we have home dialysis, and we got 2 types of home dialysis.
Okay.
One is what we call as home hemodialysis, which is like the dialysis you do in center, except that we bring the machine to your house.
Really?
And there you do the dialysis on your own. So what we do is we train you and your spouse or your significant other or whoever is at home with you, caretaker, for that. And then we got this great system where our nurses can actually come to your house at a time which is convenient for you
and the caregiver.
And then we train you in your home, so that you don't have to, you don't
have to go to the dialysis center. If you decide you rather do it in-home for convenience for the patient or for the caregiver or the spouse, who's probably a working person too, then your nurses will come out and train. And how long is that training?
So the training there are 2 types of home dialysis. One is the home hemodialysis, and one is what we call as peritoneal dialysis, or PD.
All right.
And both of them can be done at home, and typically the training takes about 2 to 3 weeks.
Really?
Yes, because we want to make sure that the patient and the caregiver,
they're comfortable,
are extremely comfortable, before we let them do it on their own.
Oh, okay. So it's kind of like an on-the-job training.
Absolutely.
With the teacher's eyes being the teacher being the nurse to come. So one is hemo and one is
PD. Or peritoneal dialysis.
Okay. So what's the difference? Is one with blood and one is not, or what?
Correct.
Okay.
So the home hemodialysis is like the dialysis that you have in the center, except you do it at home. So what happens there is that's the one that involves the blood, in the sense that we hook you onto a machine, and your blood goes from your machine. The machine cleans the blood, and then the clean blood goes back to you.
Okay.
And
so that's hemodialysis.
Hemodialysis.
Okay. All right.
And whereas the peritoneal dialysis, there is no blood involved at all.
Okay, so for those that might be afraid of the blood, like
Absolutely.
myself, then the PD. Okay, and so what is that doing? It's
So the PD or peritoneal dialysis, in which what we do is that we will have a little, like a little plastic tube kind of thing. We have it placed in your belly.
okay.
It's like a IV line, about the thickness of an IV line, just around your belly button area.
Really?
And so what we do is that our staff will come and set up a machine in your house. And then the way the dialysis works is that just like you have the IV bags with fluid in them,
Right.
the peritoneal dialysis, you have fluid bags, and we connect the bags to this tube, and basically the fluid goes into your belly,
Oh, wow.
and it sits in your belly for a few hours, and the toxins from your body go
Really?
into that fluid.
So it's like purifying.
Correct.
Oh, my goodness.
And then all that fluid, we drain it out. The machine drains it out. So that way that there's no blood involved, but at the same time, all the toxins from your blood are getting cleaned out by the machine.
Really? And so the PD is one the individual probably could do by themselves.
Absolutely.
And then the hemo, they probably need the partner.
Correct.
Just to make sure. Really? And so this is something that is a new option.
Absolutely.
Years ago, you didn't have that option. But you all are really trying to encourage.
We are, and because we feel that if a person is able to do this at home, like one of the things which my patients tell me a lot is that that frees up their whole day.
Yes.
And
Can they do it while they're sleeping?
yes,
Okay.
that's a great question you asked. With the PD, the peritoneal dialysis, one of the biggest advantages of it is that you can do it while you sleep.
Really? So when you wake up, it's done.
Absolutely.
And you can get ready to go to work or start your day with
Correct.
whatever else you're doing.
Yes, so what we do in that is that the machine is set up, we set it up just next to your bed. And what happens is that before you start, you will put the fluid bags on the machine. And as you get ready to go to sleep, you connect the tube to the machine, and basically the machine does everything.
Really?
And you
It's no
don't-
guesswork.
No guesswork at all.
Oh my goodness.
So-
and so people can learn this because I'm not, thank God, there. But people can learn how to do this with being trained by your nurses
Yes.
in 2 to 3 weeks.
Yes.
And that will free up a lot of their time. And it frees up the family member. No one has to shuttle them back and forth.
Yes.
Okay, well, what we're going to do, take our final break, go to our sponsors, and then we'll be right back.
Sure.
We'll be right back after word from some of our sponsors. Straightforward is brought to you by Warrior Outreach. Contact Command Sergeant Major Retired Sam Rhodes or Kathy Rhodes. The Hugel Foundation, enriching the community through Christian music support, community outreach, and the Georgia Through Photography Project. For more information, call B at 706-568-6431. Progressive Funeral Home, family owned and operated since 1952. The George Ford legacy of high standards continues today in the compassionate and professional services provided. A touch of dignity for those who care. Progressive Funeral Home, 4235 St. Mary's Road, trusted by generations. Best Care, transforming minds and bodies, leading the way in the latest techniques of medical weight loss and wellness. Certified in family medicine and bariatrics, Dr. Blunt is ready to assist in the transformation of your mind and body. Call today, 706-221-6477, or visit bestcarecolumbus.com. East Alabama Endocrinology, educating and caring for those living with diabetes in Alabama and Georgia. 1400 Bradley Lake Boulevard, 3320 Skyway Drive, Suite 602, Opelika. Take charge of diabetes and live your best life. State Senator Ed Harbison, serving the citizens of Georgia's 15th Senatorial District and on the front line for veterans every day. And welcome back to Straightforward. I'm continuing my conversation with the awesome Dr. Ramanath from the Renal Associates team. If anyone ever wanted to know anything about kidney care, this is the team. It's a very diverse team.
Yes.
You have some more mature team members, and then you have some younger team members, and you are the newest member to the team.
Yes.
And of course, you did your training you were in Missouri?
Yes, and I did my residency in Missouri and then my fellowship in Birmingham.
Oh, at the UAB. So
Yes.
you and Dr. Tamori Smith on this team are the Roll Tide
Roll
people.
Tide, yes,
All right, so we have to
absolutely.
make sure we get that in just so people will know that you are the Roll Tide team members. But we were having a conversation before, and you were sharing with me that in the African American community, we have almost a crisis. And that's attributed to a lot of things. I wanted you to share that with our audience before we run out of time.
Sure. So one of the things which we find is high blood pressure, which is one of the most common causes of kidney disease, heart disease, strokes in this country, is more common among African American population. And one of the things which we find in our day-to-day practice, and which is also well documented, is that it tends to start very early
Yes.
in the African American population, and for some reason it's more severe.
More severe. And you were saying it's sometimes genetic, and a lot of it is environmental.
Sure.
Right.
So, the thing is that it's more severe in them starts at an earlier age, and then they are more likely to have like stroke or kidney failure needing dialysis or heart attacks compared to the rest of the population or Caucasians or any other population group.
And you think it's part of it is diet as well.
Diet
highly
based-
seasoned food we need to, because I know of, you all had a patient, I was at a patient event at the facility, and he had been a basketball player and he was on dialysis, and he
Yes.
was like this young, slim, he wasn't overweight or anything.
Yes.
And so I was really confused when I met him. And then another friend of mine tried to lose weight to give her son, who is a 20, 30-year-old person, a kidney.
Yes.
Because she's hypertensive, and then he was too. So you're saying we have to start looking at that
Yes.
and educating more
Yes.
in the African American community, where we need to pay attention.
Absolutely.
It's not just the old people.
It's not just the old people, because what we find is that especially among the African American population, hypertension tends to happen early and it's more severe.
And more severe.
And this is the age group, if we catch it early, if we treat it, it's so much better.
Right.
And whereas compared to when we find it at a later date.
Right, when it's chronic.
When it
Because
becomes-
your goal is not for everyone that you see to be on dialysis.
Yes.
That's the last resort.
Yes, we want, if possible, to prevent it as long as possible, if possible, forever.
Right.
Because, but if we need to, there are other.
There are other things.
to do.
And so that was why you were saying that, just because people hear kidney, they shouldn't panic.
Yes.
Because we have the acute,
Yes.
then we have the end stage,
Yes.
but those are miles apart.
Yes.
But you all have such a great team in terms of providing community education.
Yes.
So you have team members that provide education on diet and
Yes, so we have what we call as classes or education classes in our office, which is provided by some of our nurses, which is free of cost, where we go.
And it's free?
Yes, it's free.
Okay.
And there we talk about the different stages of kidney disease, what kind of diet to go for, what kind of foods to avoid, and then if it is, if your kidney disease is severe enough, and then you end up on dialysis, what are your different options?
Okay.
So we deal with a whole, a lot of things.
right in that community education,
yes.
because there are options.
Yes.
We've learned now that besides the education, which you all do a great job, you do a lot of community events, and of course the team assisted with doing one for public safety, and so we were all there trying to
Yes.
get the information out to them, because those are people that's riding every day. They need to
Absolutely.
stop and use the restroom. They need to drink water instead of sodas.
Yes.
And so you do a lot of community outreach, but you also have that education in your office.
Yes.
And just because they have a kidney issue, I want to re-emphasize this, and they need to see a nephrologist, doesn't mean it's the end of the world or the end of the road. We want to take away all of the myths and all of the fear.
Absolutely.
And that's why you all are there.
Yes.
And your nurses.
Yes.
Yes. And they do have options.
Absolutely. So that's one thing, you know, a lot of the times when we see patients come to our office, they're so scared. They think that's, you know,
this is it.
When they hear kidney doctor, the next thing that they know is dialysis.
Right.
And there's nothing in between. And what we wanted to do was educate you, to make sure that there is, you know, acute kidney disease where you can completely recover your kidney function.
Right.
And you have chronic disease where, again, you can lead a normal life as long as you take care, you are on the right medicines.
Right.
And then you
and
have
then the right treatment.
And the right
And
treatment.
then with the in-home,
Yes.
instead of going to a center,
Yes.
that means that you can still travel, go on vacation, and if you're doing in-home, then you can travel with your equipment.
Absolutely. So you, even if you end up on dialysis, you still have the freedom. You can, you know, do the dialysis at home. Like one of my patients was saying that he does his dialysis while he's watching TV.
Oh, okay.
He does the home hemodialysis.
And that's the one with the blood.
That's the one with the blood.
Really?
And he just says, I just sit there, so I asked him, when do you do it? And he says, well, doc, I do it when I get home, I finish my dinner, and when I'm watching my television, I do it.
Okay.
So
he's doing it at the end of the day while he's just relaxing and decompressing. When he's done with it, and he gets ready, go to bed. And so that's like going back to a normal. And then the one with the PD.
PD, that's the other one is, you know, it's so
While
great
you're
that
sleeping.
it does it while you sleep. So in the morning, you just switch it off, and you go to work, you do whatever, you know, you would want. You have the whole day and pretty much the whole evening to yourself, you know.
Right.
So,
well, I just think it's phenomenal. The team is awesome. Again, you all offer free education. All they have to do is call the Renal Associates office,
Yes.
and your nurses will be happy to educate them on dialysis, diet, and all of the great things they need to know.
Absolutely.
We also, before we run out of time, have options. So they don't have to go to the center like the old
Yes.
days. They have the options of doing the hemo or the PD at home.
yes. And the good thing is now we have this great team where we can even do the training in center. So even for the training part, you don't have to come to the office. For
Right,
that.
so you can go out to the home. Right, they don't have to do that. Well, I thank this team so much for your support of this show, and it's always our intent to educate our viewers. So we just want you to just stay out there and continue to take care of the community. Thank you so much.
Thank you so much, Gloria. It's always a pleasure.
All right, thank you. This has been Straightforward. If you don't stand for something, you will fall for anything. Until next time, be blessed.
Thank you.